We have been answering your COVID-19 vaccine questions. Today is from a woman who didn't want to put her name out there, but she asked me directly, is it safe to get the vaccine if you're expecting? Here's what Dr. Stephen Feagins with Mercy Health and Hamilton County Public Health had to say.
It really is. In fact, it's safer to get the vaccine when you're pregnant than it is to get COVID. And the American College of Obstetrics and Gynecology have a statement exactly to that effect. And so while there is not a lot known, there is an increasing amount known. Most viruses can be much more serious when you're pregnant than when you're not, okay? And so that's why we really, rubella, that's why we really focus on vaccinations either before pregnancy or during pregnancy. This virus is no different. And so you've seen some increase in respiratory failure and things like that in pregnant females. There also appears to be an increase in premature births. Okay, and with COVID, and so the risk of COVID is so much greater than the risk of the vaccine.
This particular mom-to-be is wondering if the vaccine, or if anybody knows if the vaccine can have a long-term effect on a fetus. Has that been studied?
So there is some evidence that the antibody response to COVID that is protective to the mother is protective to the fetus. So it's a good thing. Is there any danger to the fetus? Not that we know. We have an increasing amount of evidence, an increasing amount of experience. Nothing has come forth as being dangerous.
Coincidentally, Good Morning Tri-State is addressing this very matter tomorrow morning. I spoke with reporter Allie Kramer about the information she has gathered for you. Info that always includes talking with your own doctor.
What have you learned, Allie, in your reporting on this subject?
Yeah, and I talked to Dr. Emily DeFranco over at UC, and she is a maternal fetal medicine specialist, so as well as an OBGYN. And she says she's been vaccinating pregnant healthcare workers this entire time, and kind of echo those same sentiments that you kind of have to weigh the risks. So are you someone that is in strict quarantine? Do you work from home? You're not exposing yourself to other people at the grocery store? Then your risk of contracting COVID-19 is probably pretty low, and maybe you're going to choose not to get the vaccine. But somebody like a healthcare worker who is interacting with patients and their families on a daily basis, their risk is much higher. And she said she has not met one healthcare worker, I should say pregnant healthcare worker, that has turned down the COVID-19 vaccine.
Allie's report and the general questions come as the World Health Organization said it did not recommend pregnant women get the shot. She addresses that in her stories tomorrow on Good Morning Tri-State between 5 and 7 a.m. And remember, if you have a question, you can email newsdesk@wcpo.com or just message me on Facebook.